Hello everyone, this is Dr. Mamta Sarmah, a gynecologist and obstetrician. So travel during pregnancy is very common nowadays. So today's women are professionals and working women and they need to travel very frequently. So this is a frequent question that is asked that, ma'am, can I travel during my pregnancy period? Being pregnant doesn't mean that you have to be stuck up at home. Due to professional reasons or personal reasons, you may need to travel. So the normal pregnancy is a strong and robust one, and because this is not a disease. But you need to take certain precautions while traveling during pregnancy. There are many do and don'ts during pregnancy, and these do and don'ts and precautions that we are going to discuss today. So let us know at first which are the conditions when you cannot travel. When there is a previous history of miscarriage, if there is any previous history of preterm birth in your previous pregnancies, if there is placenta previa or the placenta in this pregnancy is low-lying, you need to take precaution while traveling and you need to take advice from your doctor. And if there is leakage to your vagina during this pregnancy, you need to be very careful before thinking about traveling. If there is application of cervical circlase in this or previous pregnancy, cervical circlase is a condition when a tie is applied in the lower part of your uterus to prevent preterm labor or frequent abortions. Then also you need to avoid journey. Then if it is diagnosed that you are having multiple pregnancy or twin pregnancy, then also traveling may be hazardous for you. And if there is any sign of preeclampsia or high blood pressure or increase in blood sugar level in this pregnancy, then also you need to take very much precaution before thinking about traveling during this pregnancy. In certain cardiac conditions, if they are diagnosed previously or in this pregnancy, or if there is presence of DVT in the family history or in you, then you need to take precaution or better to avoid pregnancy in this pregnancy. Now, what is the best time to travel during pregnancy? It is usually advised that in the first 3 months of pregnancy, it is better to avoid long journey, because at this time the mother is suffering from nausea or vomiting or certain discomfort which may hinder traveling during this period of pregnancy. So it is usually said that from 14 to 28 weeks of pregnancy is the golden period to embark on travel during pregnancy. So you can plan pregnancy in the second trimester of pregnancy, when there will be less discomfort while traveling. So let us discuss the means of traveling, such as aeroplane, train or car or bike journey. So for a long distance journey, aeroplane is the best method of traveling. The rules and regulations usually differ in different airlines, but traveling is usually allowed in the first part of pregnancy. There may be restrictions in the later part of pregnancy. In the domestic airlines, traveling is usually allowed till 36 weeks of pregnancy, and after 36 weeks, there is signs of spontaneous labor. So there is restriction in the after 36 weeks of pregnancy. But if there is twin pregnancy or multiple pregnancy, there is restriction up to 36 weeks. But this may differ. You have to check the airlines you are choosing to travel. For the international airlines, for singleton pregnancy, the restrictions is usually up to 35 weeks. Some of the precautionary measures which you should take during a flight are: keep yourself hydrated, always fasten the seat belt properly, fasten the seatbelt below the belly button. This will help you to maintain the balance. Do not consume aerated drinks or spicy food before traveling because this may help to form gas, and this gas may expand in the high altitude, which may cause problem for you. Always carry your prescriptions and your medicines along with you, but because it may be even needed when you land in your arrival. Take an aisle seat because this will help you to go to the restroom, and always try to move your legs whenever possible, or even walk when you are not using the seatbelt. This will again help you to prevent DVT because there is a small increase in the incidence of DVT in pregnancy. The precautionary measures are almost same when you are traveling by bus or by car. If you're a good driver, then you can drive your car on your own, but you should keep a proper distance or a good distance from the dashboard from your baby bump. And you should raise the clutch and brake with your leg properly. One more important thing is that when you use the seat belt, the lower part of the seat belt should be below the baby bump so that it helps to maintain your balance. One more important thing is that when you travel for a long distance and if you are driving yourself, you should not drive for more than 4 hours. And even if you are not driving, then you should use the seat belt and stop for a while on your way so that you can walk and have some exercise of your leg. This is again to prevent DVT, which increases because there is small increase in DVT because if you stay in a static position. Another important thing, whether you travel by any means, you should not travel alone. There should be a responsible person with you so that if you have any problem during your journey, that person will have some responsibility to take care of you. Always remain hydrated and have easily digestible food so that there is no stomach problem during the journey. If you are having motion sickness, you should take medicine for motion sickness before starting the journey, and you should take all the medications, the prescribed medications during your journey because you may need your medications during your journey. Train journey is safest for a long distance journey, but the rules and regulations will be same. You should take a responsible person along with you where you go to another place. Always carry your medicines and do some light exercise in the train, which can be easily done during the train journey. Now, what is DVT? DVT is a deep vein thrombosis. Pregnancy itself is a hypercoagulable state. Hypercoagulability means the blood coagulates or clots easily. In DVT, there is formation of clot in the veins of the body, and this clot may travel along with blood to any major organ of the body like brain or lungs or any other major organ, and this may be life-threatening for the pregnant mother. That is the reason, though the incidence is not very common, we are worried about DVT, and because during traveling the pregnant woman will be in a static position. That is the reason the legs should be moved frequently and light exercise should be done. And with advice of the doctor, compression stockings or compression bandages can be used. This is especially important when the pregnant woman is obese, there is family history of DVT, or there is previous history of deep vein thrombosis in the pregnant woman. These are the occasions when the doctor and the pregnant woman herself should be more cautious while traveling long distance. Now let us know which are the conditions you have to cancel your trip immediately. First, we have to talk about sudden pain in your abdomen. This could be your labor pain, and this may come prematurely. There may be leakage to your vagina, or there may be hemorrhage or bleeding per vagina. Then also you have to cancel your trip and seek immediate medical help. If there is sudden shoot up of blood pressure, or there is impairment of your vision or severe headache, then also you have to cancel your trip and take immediate medical attention. Now let me say a few words about two-wheeler, because nobody travels in two-wheeler long distance, but two-wheeler we always tell to avoid, because as the pregnancy advances, your abdomen increases in its size, and there is shift of center of gravity. So that is the reason you should always avoid traveling even short distance in motorcycle, because there is an increased chance of fall and injury. So these are the few things that we have discussed about traveling during pregnancy. Hope this will help you, and in our next videos we'll be discussing more about pregnancy problems and pregnancy questions.